Back home during the August break, all I heard from one end of the district to the other is about the challenges that people are having with the high cost of living. A couple of weeks ago, the Connecticut Insurance Department set out a big warning flag that next year's insurance rates are going to go up to the tune of double-digit increases. And also included in their findings was that the absence of federal support for health insurance, which is really on the verge of falling off a cliff, is going to aggravate that problem, make, in fact, the problem worse. Today, on September 19th, we had an opportunity as part of the spending bill to keep the government open, to truly keep it clean and extend that federal support for about 150,000 citizens of the state of Connecticut that use the Connecticut program that's there. The leadership in the House, the Republican leadership in the House, refused to make the spending bill a true clean bill by extending last year's programs on a flat level basis. And instead, that cliff is now still in place. We have 11 days before the government could possibly shut down. That gives us time to address this problem. I voted no on this package because of the lack of true extension of all programs, including health insurance, which is so important to people and costs so much these days. But we still have time to go back and negotiate and compromise in terms of coming up with the final package. Unfortunately, the Republican leadership walked out of the room about a week ago and just basically refused to have any discussions on a bipartisan basis for this very necessary issue. I want you to know the issue here is about protecting people in Connecticut and in Eastern Connecticut in terms of making sure that their health insurance, which is probably one of the most expensive parts of their household budget, is actually kept in control as opposed to having skyrocket out-of-pocket costs, which, as I said, is the number one issue that I'm hearing back home. Please contact my office if you have questions. Thank you for listening.